We salute our brave soldiers who are guarding our borders to keep us safe and secure. We stand together united in our fight against terror. Jai Hind. So, welcome you all in a different venue. I'm doing a YouTube live. Uh, Let us start the question answer session. I think in the last, I hope you can hear me properly because the venue is shifted and there is some issue in the light also, in the internet also. Let's close the light. So let us understand first which questions basically are left behind, and then we'll start our session. So let us go forward and so let us go forward. Last time we had some questions and they were unanswered because of the time. Nice, thank you. There was a question where the patient one of the participants, one of the doctors wanted to ask something about the urine complaints. Now see, whenever you have urine complaints in our Mathematics, there are a lot of things where the urine is containing bile, it contains blood, it is black in color, it is XYZ. Whatever I have seen in my practice, most of us we see the urine is dark yellow in color or it contains blood. More of bloody urine is very common. So understanding in bloody urine there are a lot of remedies. First, make a diagnosis why the urine is bloody. How is the patient behaving in that pattern? For example, I had a case where the patient was suffering from bloody urine with severe backache. So what I did, I took the case and I gave the remedy, and of course I gave cantharis, I gave pulsatilla, I gave cannabis, nothing worked. But if you go and see the Mathematica, there is one remedy, that is bloody urine with backache. And you will be surprised that bloody urine with backache, the remedy is Calibicrome. So I gave the patient Calibicrome 30, after 1 week Calibicrome 200, and that cured the case. So this is very important. So this is very important to understand how to prescribe and when to prescribe, and always don't prescribe cantharis or millefolium or cannabis or mercury or arsenic or argentum. These all remedies are there in bloody urine, but you have to have symptoms for that. For example, I'll tell you, bloody urine in clots. Urine contains blood and it is clotted. So what happens bloody urine with clots? There are a lot of remedies, but I would give my experience. Cactus and ipecac have given me very good results. So before I again go, I'll just take one question. Sir, एक लड़की की age 20, her breast skin is peeling and also dry. Last month से and medication से ठीक हो गई थी, फिर से हो गई. ईशा, इसका मतलब ये है कि आपकी दवाई, अगर आपको लगता है कि ठीक हो गई तो आपकी दवाई सही है. इसको एक थोड़ा पोटेंसी बढ़ा के दीजिए, या जो 30 पोटेंसी अगर आपने दिया होगा उसको रिपीट करके देखिए 2-3 दिन के लिए. मेरा मानना ये रहेगा कि वही रेमेडी आपके पास LM पोटेंसी में है, LM पोटेंसी के अंदर, तो वो LM पोटेंसी अगर आप शुरू कर देते 0/3 तो उससे अच्छा रिजल्ट आ सकता है. राजा नफीस, chocolate cyst, do nothing, just take a good case and prescribe the remedy. I have never prescribed for chocolate cyst any specific remedy. Good afternoon, Dr. Sindhu. So I was telling something about urine complaints. Third symptom in urine, you'll find I had a case where the patient had urine complaints after suppressed eruption. The patient was suffering from urticaria. He was much better with the treatment, allopathic treatment, and he came to me for treatment. And the patient had blood in the urine. Of course, whenever there is a blood in the urine, it is very important to understand, to at least make a diagnosis so that you know what you are treating. Of course, symptomatic relief is always okay, but then urine bloody from suppressed eruption. The first remedy which normally it comes in the mind is sulfur. I gave sulfur, but there was no change. Then I retook the case, and the remedy which came in the therapeutic chart was conium maculatum. And you will be very surprised to know that conium maculatum is also given in the rubric and in the Mathematica, that bloody urine after suppressed eruption and conium maculatum cured the case. So there are a lot of cases where you see that importance of bloody urine and what is the complaint associated with that. That is very important. One patient regarding conium, I'll just tell you one thing. I had a case where the patient came and told me that, sir, whenever I pass urine, the first part of urine is bloody, and then then it is a normal urine. And this is happening for a long time, and doctor said it is nothing. When the patient came to me for treatment, I was searching for this symptom, and this symptom is also present in conium maculatum, where it is written that the first part of urine is bloody and then the patient passes normal urine. My dear friends, such an important symptom, my dear friends, conium maculatum. Okay, before that I go forward in urine complaints, I'll just take one question. So calendula ointment is good for skin peeling and dry skin. Yeah, Isha, you can try that. Calendula ointment you can give for skin peeling, it should work. But for a curative case, if you give in potency or in LM potency, it would be better, but it definitely works. Now, going further in this bloody urine, because there were a lot of questions regarding that. So and people always say give Cantharis, give Berberis, give Millefolium, give Irigeron. It is not like that. I had a case, the third case I'm telling you. I had a case where the patient was suffering from blood in the urine, and the patient had history of recurrent kidney stone, and the patient had pain in the region of kidney. Now, what happens? Now, if you get these type of symptoms, we normally start asking, how is the pain? Is the pain migrating from the kidney region to the thigh? Is the pain migrating from kidney region to the abdomen? Is the pain migrating from the kidney region to the symphysis pubis? Or there is a bubbling sensation, or which sensation is there? We ask lot of symptoms. But now if you see Mater Medica, this was a very interesting case. Please do listen to this case first, then I'll go to the other questions. This case, the patient came to me for treatment and I also failed twice. But then I just tried to see the simple symptom what the patient is telling me. The patient had blood in the urine and there was some kidney problem, kidney symptoms. If you go in the repertory, if you see bloody urine in kidney complaints, the only remedy, you know what it is? It is eucalyptus. Very, very surprising. I also very surprised. This was the first time I had prescribed eucalyptus for kidney problem, and especially bloody urine with kidney problem. So for me also it was surprising. I had only eucalyptus 30 in my clinic, so I gave the patient eucalyptus 30 2 times a day for 3 days, and I will not say to my surprise because it was there in the repertory. The patient got better within 3 days. So this is the importance of understanding symptoms and then applying these symptoms in your practice. You can have beautiful stories about the remedy. You will enjoy that stories, you will enjoy the Mater Medica, but whether that will help in your practice, that is very, very important. For example, if you see eucalyptus, in eucalyptus, if you have boric Mater Medica, it is written in the Mater Medica, eucalyptus is a powerful antiseptic. It is a powerful antiseptic. See the word antiseptic. And destructive to low forms of life. It is a stimulating expectorant. ये कफ निकालने के लिए बहुत काम में आता है. And I had used this eucalyptus before in my practice for a lot of complaints related to respiratory tract, but not related to urinary complaints. And that's why, in my opinion, in my practice also, every time we are learners, we learn homeopathy every day. And that's why I always keep telling to my assistant who are working with me, to my students, to you also, keep studying, keep reading Mater Medica every day, so that you get a lot of knowledge every day of Mater Medica. If you see the indications of eucalyptus, which I have used in my practice. Hello, Dr. Barbal. You are about 10 minutes late. So, if you see the indication of eucalyptus, which I use for practice, is profuse expectoration of offensive mucus. patient expectorates lot of mucus, which is very offensive. And that's why this remedy is very importantly given in bronchoria. You can compare eucalyptus with balsam Peru. Okay? Are you with me? Hello? Are you with me? So let us go forward. This is the indication of eucalyptus. I was just going to the Mathemedica. I was reading it, and that's why I came to know. Let us go forward. Can I use Thuja 30 and Vinca minor 30 for reduced dandruff and regrowth of hair? I am 32. Yes, why not? You can use. There is no problem. You can use the remedy. So this was eucalyptus, which I used for practice. And then when I was studying, eucalyptus in my clinic, and I was explaining the case to my doctors who are with me, we started to read some symptoms in urinary tract. And to my surprise, eucalyptus has lot of symptom in relation to kidneys. First symptom that you should remember of eucalyptus is acute nephritis complicating influenza. Means the patient is suffering from influenza. If the patient is suffering from hay fever with acute nephritis, think about eucalyptus. Bladder feels loss of expulsive force. There are a lot of patients who come to us and say that when they urinate, the urine does not fall in front, it just drops, because they have no what you call strength in the muscle to urinate. So see, a beautiful symptom of eucalyptus, bladder feels loss of expulsive force, my dear friends. Such a fantastic symptom of eucalyptus, which used in our day-to-day practice. You can see in which diseases you can use eucalyptus. So that is today I wanted to make you understand, and one case of asthma which I cured with eucalyptus is, there was asthma with great dyspnea and palpitation, my dear friends. There was a lot of palpitation with dyspnea, and eucalyptus cures the case. Of course, these cases are those cases where I failed with my constitutional medicine, and then I tried to see the symptoms of the patient and tried to repetize and tried to see the symptoms in the books, and then I prescribed eucalyptus. So this is very, very important. Good afternoon, Dr. Navjot. Extremely weakness due to overhand job and male organ, weak and nearly discharge. I did not understand the question, doctor. Extremely weak due to overhand job and male organ. I suppose you are asking something about weak erection and early discharge. So see, whenever if you're only prescribing symptomatically, so weak erection and early discharge, you must think about sulfur, you must think about Agnes cast, you must think about yohibinum, you must think about lycopodium, you must think about Damiana. These are the remedies which normally you must think about if you have only these symptoms to answer. In fact, when I was in Germany, I had discussed I discussed two remedies there. One was yohimbinum and one was Agnes cast. So these are basic remedies for sexual organs, weak erection and early discharge. You can try these remedies, but I would still suggest that if you can take out few symptoms more from the patient, it will be better, and so that we are very confident that the remedy will work. Okay, this is my experience. Watery semen, yeah, you can. So if see watery semen, low sperm count, you can definitely think of these remedies. Of course, it is because of malpractice or excessive masturbation, or because of bad habits. Then you can think about acid phosphorus also, and there's one more remedy, that's argentum nitricum also. But these are the remedies if the symptoms correspond, if the symptom similarities, then that is very, very important. So let us go again to the urine part. There were a lot of questions. Blood in the urine. See, in summer, Nagpur is very hot. It is now 45 degrees Celsius. It's very hot. So there are a lot of urine complaints. And I always tell to my students, don't always give natrimur, belladonna or cantharis. So going further, there are some cases where the patient comes to you and tells you, sir, whenever I pass urine, I feel some shivering and slight blood comes out. Have you ever had the symptoms in a practice? Anyone? So the patient ऐसी ठंड लगती है ना, ऐसी patient को ठंड लगती है, and then the patient starts urination. The patient feels chilly, there is shivering for a few seconds, and then the urine starts, and urine contains blood. So in this condition, normally whenever I've asked this symptom to my audience, the first remedy that comes to the chat box is that pulsatilla. More the chill, more the complaints. Of course, pulsatilla is there, my dear friends, but if you see closely this symptom, the patient, ask the patient from where the chill is coming, and the patient most of the time will tell you it travels from the spine. If you open the Mater Medica, there's one interesting remedy called as nitric acid. So urine bloody, shivering along the spine, the only remedy is nitric acid. So I had this case, and which was much better with nitric acid. So these are important symptoms. I'm just telling you something in relation to blood symptom because this is a very common thing. Now, in urine, there's one symptom also, the like briny substance in urine and all. These all symptoms which the patient would come and tell you. And sometimes the patient might not understand what is briny sensation, what is horse smelling urine, what is cat smelling urine. So whatever it is easy to understand to the patient, ask those symptoms first. Okay. Hello sir, I'm suffering with tailbone pain since 2 years. Please suggest. Mohit, tailbone pain, coccinodiema, very common symptom in our day-to-day practice, and very common remedy. In fact, the first remedy which we must think about coccinodiema, that is the pain in the tailbone, is hypericum. But my suggestion would be hypericum. With hypericum, you have to do physiotherapy exercise. This is very important, and also the patient has to sit on the ring so that when he gets up, there's a gravity problem, and that heals faster. Other remedies also are there. You have sulfur, you have symphytum, you have arnica. But hypericum is a very important remedy. So if you have no symptoms and still there's a problem, you can start hypericum in LM potency, which would be much beneficial to the patient. If you are understanding what I am answering, just give me some indications, some thumbs up or some hearts, so that I know that everybody is understanding. Otherwise, sometimes I feel I'm only talking to the computer, and I look at the computer that I'm talking to my face only. So if you are understanding, just give me something so that I know that you are understanding. Hypericum causes me irritation and taking physiotherapy. No, I think hypericum in LM potency would be much better. Start with 0/3, then go to 0/5, and then you can continue. And physiotherapy is a must, Doctor Mohit. Physiotherapy is a must. You must go for physiotherapy. Okay. So let us go forward. Some questions, if scrolled up, I think you can again ask me, because there are a lot of questions. Yeah. So one patient, 40 years, left shoulder injury in gym, still weakness, and it starts with anyone little press can rotate. Yeah, so there is a problem in the ligament or in the muscle, with the gym. So you can think of arnica, you can think of Belisper, you can think of sulfuric acid, you can think of ruta, you can think of conium, you can think of calcarea carb, lot of remedies. Okay. Yes, Dr. Babel says it is interesting, but writing same time is a little complicated. Yeah, I know that. And sometimes, converting German into English also takes time. So that's absolutely fine. Any other questions? A lot of questions have scrolled up, so you can always write it. So injury, if it is 2008, Supriya, that means, it has been about 14-15 years. It has become very chronic. So in chronic cases, make sure that, okay, so you have got the answer. Thank you. Sir, kindly help taking Econite 30 not helping much in fear. Should I increase the potency or switch to some other medicine? I think increase the potency first before switching. I have given hypericum mixing in coconut oil on back, which has given good results. Okay, you can do that. Hypericum, I have never given hypericum mother tincture in coconut oil, but coccinodiema hypericum is such a classical remedy, that it would work in any potency. I don't think Econite 30 would work, Mohit. You either shift to Econite 200, hypericum 30 would not work. You must go for hypericum 200 or hypericum LM potency, or hypericum AIP, my potency. That Dr. Barbal would, I think, appreciate and understand that. Chronic insomnia, please medicine with highest efficacy. Chronic insomnia, the word itself says that if it is chronic, then there has to be some chronic problem which has, which has terminated its into insomnia. For example, lot of stress regarding money, stress regarding career, stress regarding family, stress regarding children. So this small stress accumulates and it becomes insomnia. So you must basically know why there is a problem of insomnia so that we can give it. Otherwise, for insomnia, we have the basic medicine which I always tell you. We have Passiflora, we have Pisidia, we have Scaltisia california. These are the remedies which are specific, but I don't think they will work. Okay, for some time they would work, but we have to treat the cause. Why there is insomnia, and then it would be a permanent cure. B complex dilution you have to purchase from Helios, London. Sir, can Agnes cast 200 Ch 2 times for masturbation week continue for 2-3 months? No, Dr. Supriya, you cannot continue for 2 or 3 months. I think you start with 200, then after a week you assess the case. If it is not working, you can repeat. If it is not working, then 1 potency. But don't give so much Agnes castus 200. I don't know. I have never used, so I cannot tell you. But normally, gradually, if you increase the potency, you also know whether it is working or not. I think gradually 30, 200, 1M, then LM potency would be better rather than repeating 200 for 3 months. I have never done it, so I don't know how to answer this question. Okay, so I hope the urine complaints are okay. I just wanted to add something about urine complaints. There was a case where the patient came to me. If there are questions, yeah. So there's a patient who came to me and he had a very typical symptom. He said that, Dr. Saab, I have blood in the urine, and that has been so for a long time. I've been taking a lot of medicines, allopathy, homeopathy. It is sometimes better, it is sometimes worse. Sometimes better, sometimes worse. But still, I'm suffering from the same problem. So I asked him, tell me something more about that, and the patient said that the urine is bloody and it is like water, as if it is reddish water. If we play that holy festival, that red color, the same color. I feel sometimes it is only water coming out, red water is coming out, and he was very sure that that he was having that. So I also took the whole case. I prescribed the medicine and it was not working. Then when I was studying a remedy, I always tell my assistant doctors who are with me, keep reading. So when I was reading Mater Medica, there was a remedy in which it was written that urine is bloody water-like. It is given in repertory also. And the remedy, what was that? It was palladium metallicum. And the patient did not have any symptoms of palladium, palladium boosters and pompous and all. So I said, okay, let us give palladium. And now the patient is with me for the last 1 year. I had prescribed the patient palladium 200, then palladium 1M. I think infrequent doses, 2 or 3 doses of palladium. And for the past 8 to 9 months, I have not prescribed him any medicine on placebo. No symptom of blood in the urine. And the patient says for the first time for 6 months, I have no blood in the urine. So this is the importance of understanding and I always say defining the patient's symptom is very, very important. If you define the patient, why I'm telling, sometimes, you give one remedy maybe for cough complaint and his urine complaint is better. And you say, okay, I have cured the case. But it is only temporary. If you are prescribing for a particular local symptom, you have to define that symptom, or then you have to define the whole patient's personality. So the cure should not be like this, okay, I have given one medicine and suddenly it has got cured. No, it will come back again. And if it comes back, it comes in more severity. So it is important to define the patient's personality. That symptom has to run to the patient, and that's why palladium cured that case. I hope you understand that, everyone. Sir, lipoma in all over. I'm taking homeopathic medicine. How long? I don't know, Dr. Saab. Sangeeta, lipoma for me also sometimes difficult to cure. I have lot of cases. They are better with the treatment. Lipoma has stopped in the numbers. The lipoma is better. The size is also better, but still they are there. But it takes a long treatment. It takes a long treatment. Many doctors give combination mother tincture, ashwagandha, ginseng, damiana, iron mix it all. Supriya, I would not know the answer to this because I have never mixed so many mother tinctures in one. But yeah, I have also heard when I was 30 years back students and joined some doctors, they used to give. I used to give maybe at that time 30 years back, but I now don't give it. So I don't know whether it works or not. If it works, you also tell me so that people come to that it works. And these are all tonics, ashwagandha, so the patient would feel better with that. Which homeopathic company medicine is best in efficacy in Mangalore? I would not know, Doctor Saab, because I use the medicines from Mayons, everything, all potencies from Mayons, and the new potency which I have made also I have made from Mayons. So I cannot answer this question. Navjot, thank you. Yeah, so one, if there is one thumbs up, so I know that people understanding. Sometimes I have to answer it very fast because there are a lot of questions pending. Okay, so I think bloody urine, you understood that? Anyone? See, there are a lot of other symptoms of bloody urine also, but this is what I have seen in my practice, and so I can tell you, I can tell you one thing also, that I had a case, where there was blood in the urine. The patient had done all the tests. All the tests were normal. He had taken all the treatment. No result with the medicine. No result with the medicine. He was with me for 2 or 3 months. I had tried medicines, but no result. Ultimately, I prescribed, while reading the remedy, I prescribed belladonna 200, and that cured the case. If you open belladonna mater medica, it is written urine bloody without any pathological reason. See, this is homeopathy. So it is very important to know for which symptom you are prescribing, how you are prescribing, on the local symptom which has a syphilitic trait, or on the patient's personality of the syphilitic or the psychotic miasm. Cure can never be by luck. 1 or twice you can have, but for cure, if you want to grow your practice, you must have reasons why you are giving the remedy. It is not like that I have given for respiratory tract and his stomach is better, so the patient has cured. You must know why. Then only you can be a good prescriber. Okay, I hope you are understanding. Where can I get LM potency in Mumbai? I don't know, Disha, so you can try. I think in Mumbai, Roy Pharmacy is there. I think Zurastin is there. You can try in those pharmacy. Yeah. Hello, doctor. Can you suggest me best medicine for premature ejaculation less than 1 minute? Whatever medicines I think the doctor has written before, ashwagandha, avena, ginseng, Agnus cast, damiana, sulfur, all medicines have the same. Agnus cast, acid frost, FSA, every symptom is important. Why? Hypertension 160/90, boy aged 18 years, no reason, only pain in the left arm, no hereditary. Oh God. Hypertension, blood pressure. Just ask, where has the pressure increased in the mind? The pressure increases here, the baroreceptors increases, it touches, blood pressure increases. So there has to be some reason. Otherwise, 160/90, maybe it is called as essential hypertension, and that's why the body is maintaining that pressure, because the boy or the patient is working that much and that much pressure is required. Okay. Parotid gland swelling, you can think about a lot of remedies. You have parotid swelling, you can think about conium, you can think about calcarea flow, you can think about parotidinum. There are a lot of remedies, but I need symptoms. Calcarea flow, Cilicia, there is any list of remedies, Merxol, Naxwamica, lot of remedies. Okay, so I think most of the questions are answered, few questions if you have scrolled up. So let us go of any other time left. Once again, We salute our brave soldiers who are guarding our borders to keep us safe and secure. We stand together, united in our fight against terror. Jai Hind. And thank you very much for joining. Thank you for a valuable time. Until next time, I hope you enjoyed as much as I enjoy sharing my knowledge with you. Until next Saturday, thank you.